My name is Micah Jones. I'm an orthopedic surgeon at LewisGale Hospital. I subspecialize in adult hand and upper extremity, as well as I do all the pediatric hand and upper extremity for the hospital and the surrounding areas. Basilar thumb pain is usually a patient that comes in saying their thumb is hurting in this region right here. And it's usually exacerbated by writing, pinching, gripping, or opening jars. Very commonly seen in females in the 50s and 60 age population. It can be a very painful condition that inhibits patients from doing their normal day-to-day tasks, such as even opening a door, because the key pinch is so painful when they're doing this maneuver that it puts significant pressure on the base of the thumb. So this is a hand, and this is showing the base of the thumb. And really this model is just demonstrating the fact that the joint has worn out, and because of the loss of cartilage, the bone starts to form these bone spurs. And very commonly the patient will come in and they'll have this bump on the back of their hand. And the bump on the back of their hand will be right here. And commonly people think their thumb is dislocated, but really all it is a significant bone spur that's caused from the severe arthritis, because as the body forms these bone spurs, this model actually demonstrates this quite nicely, the bone starts to shift this way. And as it shifts this way, it causes a bump on the back of the thumb. And that bump is very common and it's very painful. How do we diagnose basilar joint arthritis? Pain in the base of the thumb, pain with pinch, grip, opening jars, things of that nature. So when a patient is referred to me for thumb arthritis, I always get an x-ray of their thumbs, and then I go over the x-ray with the patient in the office. Then we talk about treatment options. Treatment options for basilar thumb arthritis are conservative at first. Splinting the thumb, holding the thumb in a position like this can help prevent the pain because you're preventing the pinch. I also start patients on anti-inflammatories, Advil, Aleve, or even prescription strength anti-inflammatories. Other than oral medication, I inject this joint quite often, and that can be very pain relieving to patients, specifically because the bone-on-bone arthritis is so bad that the steroid shot can give them significant relief. Therapy for this condition is not very beneficial because once the arthritis has gotten so far along that doing any particular range of motion or strengthening usually just exacerbates the therapy. So, surgical options after they've failed conservative management, including injection, splinting, and activity modification, would be replacing the base of the thumb joint. Surgery for basilar joint arthritis is usually a joint replacement surgery. The benefit of thumb replacement surgery for this particular arthritis is there's no metal components. There's no implant that requires cement like a total knee replacement or a total shoulder or a total hip. All of the stuff that I use is your own tissue. The surgery is an outpatient surgery. It takes about 2 hours. You're in a splint for the first 2 weeks and then a short arm thumb spica cast for an additional 3 to 4 weeks. I always tell my patients after thumb replacement surgery that it takes about 3 months to get 80% of their recovery, and it takes up to 12 months to get that extra 20%. So usually patients are feeling pretty much back to normal around the 3-month mark, but it really takes quite some time to feel like they're back to normal, quote unquote.